Hello and welcome to another edition of the Osteopathic Lyceum podcast. I'm going to go through a recent article that I was able to identify or find on the International Journal of Osteopathic Medicine website. So this is currently an article in press, and the name of the article is Evaluating the Information Quality of YouTube Videos on Manual Medicine / Therapy. So the title does a pretty good job of telling you what the heck they're attempting to do. So they have some criteria for identifying videos, looking at them, and then they will describe the tools that they use to evaluate their questions. So what I have access to is the abstract. So we'll go through the abstract and then we'll see what the heck it has to say. And we'll pick it apart, some of the tools, just so that you understand the type of question that was being asked. So sometimes, even when you don't have the full text, you can sort of get closer to what the author group was trying to do if you can grab some other resources that informed what they were up to. In this case, we'll read the abstract. So the objectives. This study evaluates the educational quality and reliability of manual medicine therapy-related YouTube videos to determine their suitability for information seekers and their potential use in manual therapy education. So they have a set of approaches whereby they're attempting to evaluate something about this. Now, the terms that they're going to use are educational quality and reliability. If you look at the tools that they use, there's very specific definitions of that. We're not necessarily absolutely going to hit that, but we're going to hit what those tools do to help you understand it a bit more. Methods. A cross-sectional analysis of 113 YouTube videos related to manual medicine / therapy was conducted. Video characteristics, including likes, dislikes, view count, duration, and speaker profile, were assessed. Popularity, educational quality, and reliability were evaluated using the Video Power Index, VPI, Global Quality Scale, GQS, Journal of the American Medical Association criteria, and modified discern tool. The two that I'm going to point to the most are going to be the VPI and the discern tool, just so that you have some concept of what these authors were working with or attempting to do. So, results, and we'll go back to those tools in a few moments. Results. No significant differences were found among speaker groups, physicians, physiotherapists, osteopaths, and chiropractors in assessment parameters. Videos on manipulation, mobilization, stretching, examination received more likes and views than general information videos. Video duration positively correlated with JAMA, GQS, and M-Discern scores, indicating higher educational quality in longer videos. However, overall educational quality and reliability were moderate to weak. The conclusions, this is again contained within the abstract. The study underscores the need for content creators to enhance the educational quality of manual medicine / therapy videos. Practical application-oriented content is popular, and quality video resources can serve as a valuable complement to hands-on instruction in manual therapy education. So, these authors were looking at videos with a particular viewpoint in mind. They're using the concept of educational quality that is mostly, as far as I can tell, coming out of the Discern score. Now, I may be wrong about that. I haven't admittedly looked enough at the JAMA score or the GQS, the Global Quality Score. Looked a little bit more at the VPI and the Discern. So the VPI, or the Video Power Index, as far as I can tell, and I may be wrong about this, is more about the like, dislike, and duration relationship there. So they're sort of figuring out how many people are watching it, how long are they watching it, do they like it, do they dislike it. That's a little bit more the VPI. The nature of the article, or the intent of the article, seems to carry the assumption that a lot of people are using video resources, especially YouTube video resources. So we want to apply our lens of what we term educational quality to it and see if we can do something to improve within the parameters that we're looking at. So, and the simple conclusion, the longer the video, the more educational quality seemed to be present regardless of profession. So what I'm going to do, and you can't see this, but I'm pulling this up so that I can read it appropriately. You can, if you dig around a little bit, find the original Discern tool, and they would have modified it for video. There would have been a few validation studies, or studies trying to figure out if the Discern tool works as well on video content as it does on written content. It was developed or produced or released in 1999 to evaluate the quality of health information in written materials. So I'm going to go through the questions. This is really broad. Within the original Discern tool, so you have some concept of how this is being judged, of how a video, especially a practical video, would be judged with respect to educational quality. So there's a bunch of questions. So the first question, question 1, are the aims clear? Now, are the aims clear is going to be sort of a validity question or build a validity argument. If the aims are not clear, then it's hard to say whether or not something does what it says it does, because validity writ large, or superficially speaking, is whether or not something is doing what it says it's doing, or is it measuring what it says it's measuring. So question 1, are the aims clear? Question 2, does it achieve its aims? So the first two questions seem to be very much validity questions. Question 3, is it relevant? So essentially, is the material relevant either to the aims, or is it relevant to a consumer or a reader of the material, or in the case of a YouTube video, the watcher? Maybe other terms are more appropriate. Question 4. Wait, did I do question 3? Yeah, I did question 3. Sorry. Question 4. Is it clear what sources of information were used to compile the publication, other than the author or producer? So they're looking here more at what could easily be termed academic rigor. Are people citing their sources? You could also say journalistic rigor. Are people citing their sources? Or is this piece of content citing where the information came from other than the person delivering the information? Question 5, is it clear when the information used or reported in the publication was produced? Are you using old information? Or is this information up to date and relevant? This is harder than it would seem to some. For people who constantly search for information, they're finding stuff consistently over time, whereas people who don't often search for it, they're going to more likely, based on how cognition seems to work, grab what seems relevant to them as opposed to what's most recent. It's harder to know what's most recent or what's most relevant if you're not always looking for something in a particular area. It's why expertise matters in a lot of ways, because people know often that something that was identified 40, 50, 60 years ago has really not evolved much in terms of the general understanding within a given field. Sometimes the old information is the best information. Sometimes the new information is just iteration that doesn't help, right? But if you don't know that, it's harder to do that. So question 5, as I noted, is it clear when the information used or reported in the publication was produced? That's more academic rigor. Journalistic rigor to some degree. Some people appreciate that more than others. Question 6, is it balanced and unbiased? Balanced, you could easily try to figure out, is this person only pushing one side of a story? Unbiased is tougher. People use bias, insofar as I can tell, in place of preference. Really, they should be saying preference. A bias is a mistake in thinking that the thinker does not know they're making. It is impossible, based on that concept, to identify bias in oneself. A preference is probably easier to see. In bias research, it's easier to identify bias in another person, which is the mistake in thinking that they don't know they're making, whereas a preference is probably more appropriate. Is the person delivering the message or delivering the content showing a preference for one side of information versus another? That would probably be a more appropriate question in my estimation. I didn't create the tool, I haven't gone through the validation steps, so an argument could be launched against what I'm saying, but I find the term bias used inappropriately when preference would probably be more accurate in most cases. Question 7, does it provide details of additional sources of support and information? This again is very much an academic question. This is based on academic tradition and how scientific writing has been done. It doesn't mean it's how it has to be done, but this is very much lining up with how journal editors and scientific writers and academicians would prefer things to be done. There's nothing wrong with it, but there is what you could call an argument for cultural reproduction. Do it the way that we like it done, or else we will downgrade its relevance, its reliability, its validity, stuff like that. Question 8, does it refer to areas of uncertainty? That is in many ways the key sign of expertise. Expertise seems to be expressed often with identifying uncertainty. So, yeah, you would think that people who are experts know everything. Often, what they are aware of is where things are fairly consistent, stable, trustworthy phenomenon, and whether or not, or where they are not those things, rather. So, where even though it seems like a consistent phenomenon, we're not actually sure how it works. Something like that. That is often a really quick sniff test for whether or not somebody is showing honest expertise, because they know where things are not clear and they will express that, or they will seem uncomfortable if somebody presses them to share a view that has certainty in it. They will shy away from certainty often. Question 9, does it describe how each treatment works? And this is obviously more for health information, so presenting options to a consumer for treatment interventions. Does it describe how they work? So does it do the best job it can describing a mechanism? Now, let's just say you're talking about osteopathic treatment or hands-on manual therapeutic treatment. The mechanisms are not as clear as some would like them to be. So this question may not be as useful, or it may make a lot of things look poor in video content or written content for hands-on manual treatment, because the mechanisms are not as clear, because the way that a treatment would work is going to have challenges with respect to communication. So this would probably be a really easy place for things like hands-on treatment technique or methodology to be downgraded in a questionnaire like the Discern tool. Question 10, does it describe the benefits of each treatment? Here's a problem. This is a major problem depending on jurisdiction. I would say that we should all probably revert to the jurisdiction with, or jurisdictions with as little privilege as possible with respect to things like diagnostics and things like treatment, or things like legal capacity to do particular behaviors between a practitioner and a patient. Because there may be some places where you can say things and you're legally protected, but there are other places where you really can't say it. So Ontario would be a great example. As an osteopathic practitioner, I have no legal right to speak to people about nutrition. I have no legal right to diagnose anything. And that is what it is. That is the jurisdiction under which I am working. So does it describe the benefits of each treatment? If the mechanisms are unclear and the research underlying a profession is low quality, then this is a place, so this within this Discern tool, this is a place that would make almost all content look poor, because let's just say the person examining the video content heard mechanistic claims like cranial or visceral mechanistic claims, or say strain counterstrain mechanistic claims, or say Chapman's reflex points. Well, you've got to downgrade because those mechanisms are untenable, they're unreasonable. They do not appropriately communicate what the heck is happening, right? So then question 10 to refer here, so to take it from question 9 to question 10, so the mechanisms are poor and the research base is poor within most hands-on manual therapeutic professions. So does it describe the benefits of each treatment? Well, if I don't even know how the heck the thing works, I can sort of assume benefits, and there is decent research in a lot of hands-on professions as to say what this might do to blood pressure, what it might do to heart rate, what it might do to respiratory rate, what it might do to some form of measure like skin conductance. You can find these things, but it's lower quality, it's not as consistent, so it's hard to describe the benefits. So sometimes you'd want to downgrade if they describe the benefits, but the benefits are not reasonable. All right, question 11 to move on. Does it describe the risks of each treatment? Again, this is a place where hands-on manual therapeutic practices might have a hard time looking good on a tool like this, because you can definitely describe the risks, but the risk profile may be poorly understood because of the aforementioned challenges with the research base of hands-on manual practices or professions. Question 12, does it describe what would happen if no treatment is used? This is another place where you're likely to run into problems with hands-on manual therapeutic professions, especially with their content. A lot of things, whether we like it or not, that hands-on manual practices will interact with respect to the general public, if no treatment is used, a lot of things will go in the right direction, right? So this is a place where maybe people either don't know, or say content creators don't know, or content creators may be shy to say, or business professionals who are trying to run a business of a hands-on practice may be shy to say. There may be reasonable research to suggest that shortened length of stay in hospital, shortened convalescence, shortened time to return to activity. It's possible to find that, but it's also maybe hard to find that for particular approaches or for particular professions. So this is another place where things can look bad. Question 13, does it describe how the treatment choices affect overall quality of life? What I find very superficially, this is not rigorous in what I'm about to say, is that a lot of hands-on manual practices tend to oversell on things like this. You'll hear, or you may have heard terms like prehabilitation as opposed to rehabilitation. That's a very gray area that has problems. So that would also be a place to downgrade this type of content. Question 14, is it clear that there may be more than one possible treatment choice? This is, to be fair, probably very well guided by medical ethics. So you're looking at autonomy, or the concept of autonomy. You need to ideally, so beneficence, non-maleficence, autonomy, and justice, but more so in autonomy, properly describe the benefits and the possible harms of a particular treatment, and then note to somebody, especially with respect to autonomy, whether or not there are other options for them. If you don't note that, then you're minimizing something like informed consent, because you're not providing proper opportunity for autonomy. So to choose between one approach and another, that would be pretty hard in a video trying to describe an approach to treatment. So the expectation that somebody teaching a method or attempting to describe and demonstrate a method for intervention online is going to go out of their way to tell people who, so let's just say the intended audience is people learning a profession, to tell them what the negatives would be, or if there's other options in a particular case. It assumes that the method is unique to a diagnosis, and it probably isn't. There's a lot of methods that will work for a lot of presentations. So this is a place that is very easily going to make technical content look bad. Consumer-based content. So if you are making technical content aimed at a possible client or patient, then sure, maybe you would do this, but this is more appropriate in something like a patient interaction, not necessarily demonstrating technical content. So this is another place that would definitely downgrade the quality or the judgment on the educational quality. It seems like the Discern tool is a little bit more about a consumer figuring it out as opposed to a learner. So that's a possible challenge. Question 15, does it provide support for shared decision-making? This is looking a little bit more in medical ethics about, or in the direction of autonomy. So that does matter, informed consent. Question 16, based on the answers to all the above questions, rate the overall quality of the publication as a source of information about treatment choices. So the Discern tool for educational quality is probably, and maybe let me scroll up or look at something else, just so that my first principles thinking on the fly isn't so far off base, because I may, please excuse the quiet here. I'm going to read the preface because I figure something might be here. So this is sort of on the fly. Despite a growing investment in consumer health information, the quality of information remains variable. The Discern instrument has been developed in recognition of the need for a general set of quality criteria for written consumer health information on treatment choices. There you go. So the Discern tool, with respect to educational quality for learners of a profession, would be inappropriate. So while the researchers that did the paper that we started our discussion with respect to the educational quality of osteopathic YouTube content or manual therapy YouTube content, the discern tool is for consumers. It's not going to do a decent job evaluating educational quality for learners of a profession. It's a different construct. So learning about treatment choices as a consumer is different, very different as a construct than learning how to perform a profession. If there was a different tool, and maybe let's just say the GQS or the JAMA tool, maybe those are looking at it, but the GQS, the Global Quality Scale, probably isn't a thing for that. So if I was to consider the approach that the authors took, I think based on validated tools, they used strong validated tools. Nothing wrong with the tools, except I'm not 100% sure that it would have done what they wanted it to do. So again, on the fly in live thinking, let's go back to this. Information seekers. Okay. There we go. So let me just read the objective again. So I think the discern tool may be inappropriate for the objective. The study evaluates, and this is reading from the abstract again in the objectives, the study evaluates the educational quality and reliability of manual medicine therapy related YouTube videos to determine their suitability for information seekers and their potential use in manual therapy education. So unless I'm misreading this, your attempt is to evaluate for the learner within the profession. The discern tool is probably inappropriate for that, even in a modified level. In a modified approach, regardless of how it was modified, it's more for the consumer than it is for the learner of the profession. What I will say, as somebody who obviously creates content, because we've got this far, you know that I'm creating content, the speaking videos, the videos in which I'm trying to share information conceptually, are definitely engaged with less than the practical videos. And the practical videos are more likely to perform well when you're showing the narrow thing, you're showing the method, you're describing decision making, and you're showing the method, as opposed to going through really dry pros and cons, really dry other options for this particular concern would be X, Y, and Z. People are going to tune out. That's almost a promise. They're not going to be interested in that. They're interested in the method, especially people who are trying to learn how to do a profession. You will also get into what you call audience capture. So somebody who's trying to make content and show a higher VPI is going to do what the consumers respond well to, or the consumers, the watchers, the viewers respond well to. And it's not going to be anything that looks good on the discern tool. So if anybody has a large YouTube channel within manual therapy, they are not doing it for the consumer. They're doing it for their audience, and their audience is probably a little bit more interested in how to do something than they are whether or not they're learning about treatment choices. So the discern tool, probably not appropriate. There's probably other ways, especially the video power index. It's likes, dislikes, and duration. That's not necessarily evaluating educational quality. That's evaluating consumption and viewership. So I don't think the authors did anything negative with respect to the use of validated tools. But what I would say, without having access to the full text, so some of this is maybe inappropriate critique because I don't have the full text, and admittedly so. They may have chosen things that aren't doing what they want them to do. So they did a good job of choosing validated tools, but they may not have been using them in a valid way for what their outcome goal was, to evaluate the educational quality for a learner of a profession. So they may have missed a little bit there. And there are challenges when producing content for people. They're going to go towards what they like, not towards what is useful for them. There's a major problem in education. You do have to have a customer service component. If you're not making the consumer a little bit happy or feel like they're a little bit listened to, they're going to turn away. But that is not a fundamental part of actual education, of moving from novice to expert. It doesn't matter how you like to learn. It doesn't matter if you like to listen to things, if you like to watch things, if you like to read things, if you like to feel things. It does not matter if it is inappropriate to the modality of the performance. Osteopathy cannot be learned by listening. Becoming an auto mechanic cannot be learned through listening. Becoming a sound engineer cannot be learned through listening. Listening matters because you have to hear what it sounds like, but you actually have to technically know how and why to move a slider on a board, where to place a microphone, why to place that microphone. You actually have to know conceptual things and physical things, right? So how it sounds is part of it, but how to use a soundboard, how to place a mic, how to choose a wire, why to choose this wire, that matters too. So there's all types of things when learning how to perform osteopathy. Sure, you have to know why you would do something, but you actually have to know how to do it. And you also have to have at the top of your hierarchy the ability to pay attention to the patient in the moment and how they respond to what you've chosen to do, and whether or not you should continue to do that thing, continue to do it the way you're doing it, or if you should do another thing. That's more important than any form of verbal description of the pros and the cons of it, because it doesn't boil down to that. So what if I told you the pros and cons to a degree? Understanding that there are administrative requirements and legal requirements, but they are not the thing. They are just what administrators and lawyers want you to convey and academicians want you to convey, but they are not the thing. Hands-on manual therapy is actually physically interfacing with another person and figuring out how to do that in that moment with that person. If you are preferentially taught certain methods, then you will sing their praises. But if you are preferentially taught that the primary deal is paying attention to that person and choosing things in a particular manner so that you get closer to the outcome goal, then maybe you have a different view on it. So while the researchers used validated tools, they may not have validly assessed what they wanted to assess. And I'm admitting completely that I don't have access to the full text article, so take that for what it's worth and understand that if what their research suggests, based on viewing time and based on the video power index, most of you are going to miss this message. So you're probably going to engage more with the technical videos that I do. But if I was to sit here and tell you this stuff in the technical video, you'd be more likely to tune out. So for any of you who have listened this far, hopefully you learned something. Hopefully you see how the process of thinking on the fly to some degree with some preparation works. And understand that if you're the one listening to this and consuming the technical content, you probably have a fuller perspective on it, but you still have to go out and actually do it. And while you may appreciate learning through listening or learning through watching and listening at something like this, something like a discussion, as well as consuming the technical content, that's just what you like. It's not necessarily what you need to do. What you need to do is actually physically perform the profession. So some of the things that you'll hear me consistently talk about with education are, there is a customer service element. It does matter, otherwise your institution closes. But letting the inmates run the asylum, or essentially letting the whims of the learner, who does not necessarily know yet how to perform the profession, drive your decisions in how you teach them, you're ignoring what is required for them to do. There are obligate steps to get to any skill. You can be rigid about that, or you can be dynamic about that. If you're dynamic about it, you'll get people through the steps. You'll have decent customer service. You'll have very low attrition, likely, and you'll get what the student needs. But if you listen to the student tell you what they want, well, they might tell you that they like nuts and gum together, right? It's probably not something you should listen to. Just because somebody wants something, just because somebody likes something, doesn't mean it actually is going to get them the outcome goal that they want. So, again, thank you for listening this far, and go out and do it as opposed to just listen to it. But also listen to it, because there's some value in what the heck I'm saying right now, and it will give you a fuller picture. So thank you again, and we'll talk soon.